Happy Thursday. Happy Thursday, everyone. And I have a lot I want to cover with you today. There are top 10 changes that are coming to Social Security in 2025 that I want to bring to you. And then I have breaking news. Seniors need to update their Social Security online accounts. There's been major changes that have been made to the Social Security Administration's website that needs your attention right now. And then stay till the end of this video. I have 7 food stamp changes that will affect everyone in 2025. If you're new to this channel, hit the like button, hit the subscribe button, because all we do is bring you the latest news and updates, anything in and out of Congress that will affect your food stamps, Social Security, Medicare, Medicaid, and any personal finance issues that are important to seniors. So hit that like button. I want to hear from you. Where are you watching this video from? Let me know your city and state in the comments below. We'd like to know where our viewers are watching our videos from so that we can interact with you. Now, let's get started with COLA changes for Social Security. And what I want to make clear here is that a lot of seniors were unhappy with the 2.5% COLA that was approved for 2025, and it's causing a lot of seniors financial hardship. And what I want to help with today is explain to you why COLA was so low. It was 5.9% in 2022. It was 8.7% in 2023. And then 2024 it started going down to 3.2%. And then this year it went down to a minuscule 2.5%. So you can see that it's caused a lot of stress on seniors. And the question is, why is the cost of living adjustment so low? Well, the first thing I'll tell you is that Social Security COLA has not kept up with inflation for a long time. And it's getting worse and worse because when you look at the data and you compare actual inflation and the cost of living adjustment, it's always lagging inflation. So why is this? Well, I did the research and here's what I found. It is because of how the cost of living adjustment is calculated. Currently, the government uses something called the Consumer Price Index for urban wage earners and clerical workers. That is the inflation index or the CPI index that the government uses to calculate Social Security adjustment. So what happens is that every third quarter of the year, July, August, September, they're going to look at prices of goods and services that affect urban wage earners and clerical workers. And if prices went up, then they will adjust your Social Security. If prices went down, then nothing will happen because by law, they cannot reduce your Social Security if prices went down. So it stays the same. And so the problem with this index is that it is for urban wage earners and clerical workers. It's measuring the standard, the cost of living that affects urban wage earners and clerical workers. These are not the people on Social Security benefits. And so they are using an index that does not really reflect the cost of living that affects seniors. And that is why your COLA is always behind the real inflation, because things like medical care, prescription drugs, all these big things that move quickly and affect seniors are not factors. So a lot of lawmakers have realized this and want to change how COLA is calculated to benefit seniors. There were 2 bills put in front of Congress last year, the Social Security 2023 Fair COLA Act for Seniors, and then the Social Security Expansion Act. Actually, the Social Security Expansion Act was supposed to give seniors an increase of $200 a month in addition to adjusting the COLA calculation. They wanted to create a new index that is called the CPIE. It will be called the Social Security CPIE Index, and the E stands for elderly, and it's supposed to track the spending habits of Americans 62 and over so that they can have a realistic way of calculating COLA. That bill never went anywhere. So now we're back to where we're using this outdated COLA that is only causing seniors to lose purchasing power of their Social Security benefits. So if you like the video so far, hit the like button. And before I jump into changes that are coming to Social Security, the 10 changes, let's talk about Medicare for a second, because there's an important window right now. Right now, as we speak, it is the Medicare Advantage enrollment season. And I can walk you through very quickly how to save $1,100 a year on Medicare Advantage. A lot of plans are dropping Medicare Advantage plans. So if you have a Medicare Advantage plan, make sure you're looking at it now, because this is the window. It's a very short window for you to be able to switch to a plan. Make sure that your plan currently supports your doctors, that your medicines are covered, and most importantly, that it provides the services that you need. Now, there are 24,000 Medicare Advantage plans, which is why 90% of seniors are in the wrong plan. And so this is your window to change. Otherwise, it has consequences, because it could cost you money. The average senior couple spends $300,000 a year on Medicare expenses during their retirement. And then it could affect your health, because when you need services, it may not be there for you because your plan has been dropped, or your hospital, has dropped the plan. Whatever it is, make sure that you take advantage of this window. And I have a partner that can help you. I've said this before. I've been doing this content for 14 years. I have never recommended a Medicare Advantage partner because I have not felt that anything I've been presented with felt right or meet the needs of the seniors that I am trying to advocate for. Well, Chapter Medicare is the plan. They are the advisors that can help you pick a great Medicare Advantage plan. Call them at 539-205-2147. Now, why did I pick Chapter? 3 reasons. They are the only Medicare advisor. It is a free service. It doesn't cost you anything. And they are the only advisor that has 24,000 plans, access to all of them. And so they will be able to help you find the plan that meets your need. They work with you one-on-one, and their agents do not get paid by commission. So they are not there to sell you the most expensive plan. And then they are also there to save you money. On average, they save you about $1,100. So call Chapter or click on the link in the description of this video, and they'll be able to help you now get into the best Medicare Advantage plan. So let's talk about 10 changes to Social Security in 2025 that affects everyone. The first one is obviously how much money you had in your Social Security increase. As you can see, it has not been a lot of money. The 2.5% COLA really took a hit on seniors' income. So if you're on Social Security, your average benefit, it went up by $49. If you're on Social Security as a couple, your average benefit went up by $75. If you're on SSDI, you got $38 increase a month. If you're on SSI, you got $24. And if you're a couple on SSI, you got $35. It's not a lot. And that is why a lot of seniors are struggling, because on the flip side of it, Medicare Part B premiums went up by 6%. So you have Social Security go up by 2.5%. Medicare Part B premiums went up by 6%. So already seniors are behind. And that's why a lot of them cannot make ends meet, because even if they get a Social Security increase, it gets swallowed by Medicare Part B increase. The next one, and the big change that is coming, is how much you get if you are retiring at your full retirement age. Remember, it's the full retirement age where you get all the benefits that you are eligible for. This year, if you retire at the full retirement age, the maximum benefit you can get is $4,018. It means you've paid the maximum into Social Security benefits. Next is the how much is taxed as Social Security. And I'm going to talk about this because this is also a problem and one of the reasons why Social Security is struggling. So if you make $176,100, you have to pay Social Security taxes, and that is up from $168,600 a year. If you're on disability benefits, your substantial gainful activity amount went up from $1,110 to $1,160 a month. So if you are working while on disability, you need to pay attention to this, because this is how a lot of people get kicked off disability benefits, because they're working and they breach this limit, and then Social Security thinks that you're no longer disabled, and then your benefits are cut or you are put under review, because now they think that you can work. You can actually work and you're no longer disabled. So pay attention, especially if you're on the trial work period. Another change that is coming is Medicare. There's a lot of changes happening with Medicare. Medicare Part B premiums are going up to $185 a month. Part D out-of-pocket cost is capped at $2,000. The average Medicare Advantage premium is decreasing. Standard Part B premium is expected to go up. The deductible is $257 a month. And then finally, Medicare Part 8 premiums and Medicare Part 8 deductibles and copays are also projected to increase. So the story about Medicare generally is that everything is going up. Meanwhile, your cost of living adjustment is not going up that much. That is why this is all a problem. Now, if you are working and you are claiming Social Security and you haven't hit your full retirement age, you need to pay attention to this graph, because you can only make $23,400 in 2025 to not lose some of your Social Security benefits. For every $2 you go above this limit, you're going to lose $1 in Social Security benefits. That is an increase from 2024, where the limit was $22,320. So that's important. If you're working and claiming Social Security before your full retirement age, this is your earnings limit. Now, if this year, 2025, is your full retirement age year, then you can make up to $62,160 without losing any of your benefits. If you go above that, for every $3 you go above it, you lose $1. So it's more generous in the year of your full retirement. That is an increase from $59,520 last year. And then when you pass your full retirement age, you can work as much as you want and nothing will be deducted from your Social Security benefit. So that's very important to know. The seventh change is that the full retirement age is going up. This year is going up to 66 and 10 months for people born in 1959. And then permanently is going to hit 67 next year for anybody born 1960 and later. And I'm going to talk to you about why Congress is trying to increase the retirement age, the full retirement age, again from 67 to 69. So stay. I'm going to discuss that shortly. Now, Congress is very active. The Republicans have the entire Congress, the House, the Senate, and then they have the presidency. And Social Security is one of the things that they're looking at as they try to balance the budget and pass big tax cuts and extend the Trump tax cuts. And Social Security needs action. Something needs to be done to extend the lifespan of Social Security. And I'm afraid that they're going to use that as a reason to try to reduce benefit or cut benefit, even though the president has been on record as saying they're not going to cut Social Security benefits. But these are the 5 proposals that are in front of Congress right now that they are looking at to fix Social Security. The first one is they want to increase the retirement age from 67 to 69. Why is that? Because it helps solve 30% of the Social Security shortfall. And a lot of you have been saying that Congress has stolen money from the Social Security Trust Fund. They haven't paid it back, and now they want to cut benefits or they want to raise the retirement age. Well, this is the news, because if they raise the retirement age, it slows down how much money comes from the system, and so it could solve 30% of the problem that is affecting the Social Security Trust Fund. Now, it's going to disproportionately affect people in low income, because people who are earning low income and hits age 65 usually live on average up to age 81, where people in the higher income level, when they hit 65, they live longer, up to age 86. And so increasing the Social Security retirement age benefits the higher income earners more than it benefits low income earners. And there's a lot of data to prove that. The next change they want to make is slow down how much your cost of living adjustment grows. If you thought 2.5% was low, well, they want to even take it further down, because that is also going to slow how much money comes from the Social Security Trust Fund. And so this is one of the proposals, and this alone solves 30% of the funding shortfall that is in the Social Security Trust Fund. So the 2 proposals I've talked about alone can solve 60% of the problems that the Social Security Trust Fund is facing by slowing down COLA and increasing the retirement age. But as I have said, COLA and inflation are 2 different things. This table shows you that COLA has not kept up with inflation for most of the last 14 years. Everything in red is when COLA was lower than actual inflation. So when you reduce COLA even further, you are digging seniors into a bigger hole. And Medicare, medical care inflation has been rampant. Over the last 24 years, medical inflation has increased by 121%, while prices of goods and services, everything else, has increased by 86%. So that's a big gap. And that is another reason why slowing down COLA might not be a good idea. The next thing they want to propose is increasing the payroll tax, because currently Social Security is funded by 12.4% tax split between employees and employers. They want to increase it to 13% and move it to 6.5% split between employees and employers. It has a lot of bipartisan support. So in my opinion, this is one of the things that is probably likely to be passed. The next change is removing the income gap. This is probably what they should do, because if all they did is remove the Social Security income gap, where there is no limit on how much you make and pay Social Security taxes, that would solve the Social Security trust fund problem for 75 years and only affect 4% of the population. So this is one of the things that they probably should do, but I don't know if they have the courage to do it, because this will fix a lot of problems with the Social Security trust fund. And then the fifth change is means testing. Means testing means that they're going to determine how much Social Security you're going to get based on how much you make. So higher income earners are probably going to get lesser benefits even though they've paid into the system. So this is one of the ideas that is out there to really try to fix Social Security. Let me know what you think. So I've given you all 5 proposals that are before Congress. Which one do you think is the best? Let me know in the comment section below, because this is what they are looking at right now to impact benefits that is going to affect everybody. And as they are thinking about those huge trillions of dollars in tax cuts, the money has to come from somewhere. And I'm telling you that they may not touch your benefits, but they may do things to slow down how much you're going to get in benefits. And in the future, they may slow down how the age at which people can get benefits. And that is all going to affect everybody. So with anybody who is watching, you may think that it doesn't affect you now, but all these decisions can affect your future, because these are the discussions that are happening right now. Now, this is breaking news. Social Security recipients have to update their accounts online. If you currently have a My Social Security account or you don't, you need to pay attention to this, because this is something you need to do right now. So this came from a CBS News report that Social Security has made changes to their website. And if you haven't logged in lately, you need to go in and log in. So if you created your account before September 18, 2021, changes do not affect your current payments, but it affects how you log in, because they've introduced something called login.gov. And you have to sign up to Social Security through this account to be able to access your benefits online. So there are 2 different login options right now. You can do the id.me, which is what I use to log into Social Security, because I find that much more easier. But you can also create a government login.gov, which allows you to be able to log in into other government websites. But if you were using your email previously, it may be harder and harder to use your email and username, because they are changing the system. So you have to go in and pick one of these 2 options. So why is it important to have a Social Security account? Well, if you don't get your benefits, is the easiest way to find out why. If your benefits get reduced, is the easiest way to find out why. If you haven't started receiving Social Security, it's the place to go to see how much in benefit you're likely to get, whether you've earned all the credits required to qualify for Social Security, and if you are eligible for disability benefits. Should you need Social Security disability insurance, this is the place to go to get that information. So you need to go online and make sure that you can log into your Social Security account with your current username, or you have to create the id.me account or create the login.gov account. Obviously, these are things that we already know. The earliest you can claim Social Security is 62. The full retirement age is going to change to 67 next year, and 70 years is the maximum you can delay to claim Social Security, and it's when you get the most amount. You must have 40 quarters to qualify, and 25% reduction if you start collecting Social Security at 62. These are things that a lot of you know already, but if you are new and you don't know how the system works, this is critical information for you. You can wait until age 70 to get most of the money, because every year you wait beyond your full retirement age, you get 8% more money, and the benefits are indexed for inflation. And 40% of seniors rely solely on Social Security as their main source of income. So go online, make sure you can log into your Social Security account, and let me know what you find. If you like what you are hearing, consider subscribing, consider liking this channel, and then let me know what you think about these changes that are happening to Social Security. And then finally, let's talk about food stamps. There are 42 million Americans on food stamps, and there are changes that are coming this year that are critical to food stamp recipients. So I'm going to walk you through it. I have talked about this harvest box idea a lot because I am alarmed at the fact that this is being considered. But when Trump was in office first, he suggested that he wants to change the food stamps program into a harvest box. Basically, instead of using your EBT card online or in store to buy foods that you like, the government will ship you a box of shelf-stable foods that you would have to eat, or you don't have an option. And now that they are looking at cuts to food stamps and Medicaid, in the news, this has come up again, where they want to change the food stamps program into a harvest box and shift a big share of the program, a plan which household would not get to choose the food they buy, but instead be sent a monthly box of shelf-stable food that the government picks. And the Republicans in the House are on board with this because they want to make $30 billion in cuts over 10 years to the food stamps program to pay for the Trump tax cuts. And this is one of the places they are looking to make the cuts. So this is what it's going to look like. Every month you're going to get a box of food with some canned food, with some grains and cheese, etc. And that's what you're going to get if this gets approved. And it looks like it's in motion because they're determined to cut $30 billion from the food stamps program. And that's going to hurt a lot of people because people have dietary restrictions. People cannot eat certain foods. Some people have to observe kosher. There's so many things that this is problematic for. But I don't think they care enough about the details because they want to find the money somewhere. And the food stamps program is the easiest place to look because there are not a lot of people that advocate for people on food stamps. So, number two, are they going to cut food stamps? I think they will. I think it's guaranteed that food stamps and Medicaid are going to be cut. And that is going to hurt a lot of people, but I don't think they care. I think that the poor and low income become the punching bag for Congress whenever they want to find money somewhere for people who actually need benefits so desperately. Number three, they want to ban junk food from food stamps. 23% or nearly $25 billion is spent on junk food or what is considered junk food in the SNAP program. And obviously, this has health consequences. So the governor of Arkansas, Sarah Huckabee Sanders, who was President Trump's former press secretary, wants to push for this initiative to ban junk food in food stamps. And she's leading the charge to get this done. And I believe that it will be done. But here's the thing. The idea that people on food stamps are eating junk food any different than the regular population is not true. There's been study after study that shows that the purchase patterns of food stamp recipients is no different from the regular population. So if this is pushed through, if the ban on junk food on food stamps is done, I'm not saying it's not a good idea. I'm just saying that it is not that people on food stamps are specifically known to buy more junk food than everybody else. That's not true. But if the government is giving you money to buy food, the government gets to decide what you can buy. That's how the thing works. I mean, currently there are certain foods you can buy with food stamps and there are certain foods you cannot buy. So it's the same concept. And I think that what they're trying to do here is further control what you can buy, similar to the harvest box, where they want to ship you a bunch of food in a box for you to eat versus going to buy what you like. This is all in the same boat. It's the same idea of controlling what you can buy with your food stamps. The fourth change is waivers. Waivers are going to be gone. Waivers were granted states flexibility during COVID to waive certain requirements for food stamps, and a lot more people got food stamps because of waivers. I think under the Trump administration, the current Congress, they're going to get rid of these waivers. So a lot of people are going to fall off the food stamps roll when these kinds of waivers changes are made. They're going to tighten work requirements. Currently, if you are between 16 and 59, you have to work to get food stamps, especially if you're an adult without children or dependents. Then you have to work or be in an approved work program to continue to get food stamps for more than 3 months in any given 3-year period. And so this is one of the things that they're looking at to tighten further. And I believe what they want to do is make people work till 62 to get food stamps. You may think that is high, but right now they've changed the law to 59. And so getting it to 62 is what they're determined to do because they want to make it harder for people to get food stamps, including seniors. And so unless you are exempted from work requirements, you have to work to get food stamps for more than 3 months in any given 3 years. The next thing is summer EBT. If you have children, grandchildren, if you know people who have kids, this is coming up. This summer, it's a permanent program. You're going to get $40 a month for each child for children that were getting lunches at school. So if you were participating in the school breakfast program or the school lunch program, during the summer, those kids don't get any food because school is closed. And now there is the summer EBT program that gives each child $40 a month for the parents to purchase food for the kids so that that shortfall in nutrition can be met. So it is a program that states have to sign up for, and majority of the states have signed up. It's a permanent program. And so you're going to get an EBT card for this, and it's for the summer EBT program. If you're already getting food stamps, it will just be added to your regular food stamps card. But 29 million children across the US are going to benefit from this, and summer EBT card will be preloaded and $40 per child. So if you have 3 children, you're going to get $120 a month to buy food for those kids because it's supposed to help support nutritional needs for children that go hungry, that depend on the school lunch program or the school breakfast program, that during the summer struggle because those programs are not there. So this is one of the programs that has come in and is permanent. Number 7, food stamp fraud. A lot of food stamp recipients are losing benefits to fraud. Not a day goes by without me getting an email or comment that somebody has lost their food stamps because it disappeared. And the main reason is that food stamps cards, the EBC cards, are not sophisticated enough to withstand scheming. So when you go to use your food stamps in the store, make sure that you're inspecting the key part, because sometimes fraudsters will put something on top of it and they can record your keystrokes and then take your PIN number and make a copy of your card, and then they can then go and empty out your food stamps. So especially when you're using cards in very small stores or independent stores, just be careful. I'm not saying that that is where most of the fraud comes from, but that is where you may have just one clerk that is working the whole store, and so they're not paying attention to what people are doing on the point of sale machine, and so thieves can put something on top of it and scheme your food stamps card, and then the next thing you know, you have a card with your entire benefit taken and stolen, and that is a growing problem. Every day in the news, there's something about food stamp cards being stolen because of fraud. And so this is a growing thing, and some states have started dealing with it by trying to make the food stamps EBT card more secure with chip technology. I don't know why they haven't done this, because this is technology that has been available for a very long time, and they should have changed all food stamps EBT cards to enable chip technology so that they can make it harder for thieves to scheme these EBT cards or to scrape them. Sometimes you go to, if you're using your EBT card at gas stations or at convenience stores, these are places that are notorious for schemers, because they are able to implement these fraudulent schemes at these places more easily because there's no one monitoring that consistently. And so a lot of EBT cards get stolen that way. And I think states this year, New York is one of the states that is trying to do this. California is on its way to changing all their EBT cards to chip technology. I believe that other states should follow because this is going to be save a lot of people money, and the government is now no longer reimbursing you for stolen food stamps. And I know under the Trump administration and the current Congress, they are not going to put money into reimbursing you if your food stamps are stolen. So it's going to be upon you to be proactive and make sure that you're protecting your food stamps card and food stamps benefits. So I want to hear from you in the comments about everything I've talked about today. What drew your attention? What do you think about the food stamp changes that are coming? What do you think about the Social Security changes that are before Congress? What do you think about the COLA increase and how that has been crushing seniors and everything else I've talked about? Of course, don't forget, if you are on Medicare, this is the period to get off into a better Medicare Advantage plan. And my partner, Chapter Medicare, that you see on the screen, are going to help you get a better Medicare plan, and they can save you $1,100 a year, and they're very highly rated. So give them a call. It's free, and they're unbiased. And so if they can help you, they will. If they can't, they'll tell you. So until tomorrow, when I do another live and bring you the latest news and updates on food stamps, on Social Security, especially things that are happening in Congress right now regarding Social Security, I'm going to talk about all that tomorrow. So stay tuned. Have a great night. And thank you for hanging out with me today.